Thanks, Lakshmi, and special welcome for all of you here for sparing your busy Saturday here. I'm sure you'll go home much more enriched. Especially thanks for Dr. Christina, madam. I mean, she's very busy normally, but she's graciously has taken some time out to make our conference even more special, though. Thank you, ma'am, and thanks for Dr. Yashoda and all the faculty from throughout the country. I think the who is who of neurosurgery from throughout the country and international is also here. So thanks all for coming with a red eye and all. And most importantly, thanks for the delegates coming in here. I know that Indian doctors are the hardest working doctors. Example, in US, when I was working one week was off, plus 1 month vacation because I have to go all the way to India. So I was working exactly 5 months. But I know all you busy doctors, you're so busy, like maybe only half Sunday or something you have, but despite that, you have taken your time to come here. Most of you are like really practicing doctors coming in here, so you'll go home much more enriched for sparing your time. And Christine ma'am is doing some wonderful things. So it's rare that we have doctors in the IS and admin fields. Like she's also from Usmania Medical College. Me too, a long time back. I think now I graduated from Usmania before going to US and all. But now she's doing great work in the admin field too, particularly in the health services. Healthcare is one thing which I'm proud that we are leading. I mean, some other things India may have some time to catch up, but healthcare wise, I think we can confidently say that we are first world. Like many of the things which we are doing now, there is hardly any difference. When I was first going to US and all, like something like a liver transplant, it was done somewhere there, or bone marrows, many used to go to abroad and all, but now many of my colleagues in US are also asking me, can I come and do a fellowship here for pulmonary, for neurosurgery, for every kind of field, ECMOs also. So we had 109 air ambulance transfers during COVID and 25 ECMOs simultaneously, and these are like, and everything else is also good. And similarly, Telangana is leading in like many things like per capita income, but also healthcare wise, the amount of services in government hospitals now is significantly upgraded. When I was in MBBS and all, I remember a patient who had a heart attack, like myocardial infarction. There was no, forget about cath lab, there was no streptokinase, urokinase or anything. Even aspirin, I had to buy it from a medicine shop outside and give it to the patient, only aspirin for heart attack. But now government hospitals are almost competing with us. Shortly doing multi-organ transplants, an entire wing in Gandhi Hospital, and many bone marrows, and almost everything is being done. So it's a great field of both government and private. We are doing good, and we prefer to work with each other for the benefit of everybody. And that's about the public-private partnership, and we'll be more than willing to do our part to support. And also, like coming to the conference itself, these kind of things need a lot of effort. And now coming in here and doing seems easy, but I think Dr. Yashoda sir has spent the past more than 3 months about designing for this conference, and getting these skulls. I did not realize it. It took a lot of effort and paperwork and to get, because these are not available in India. We had to import that from US in deep freezer and all. I think one of the nurses, I heard that somebody fainted yesterday knowing what was there in these boxes which have come all the way from US. Maybe she was thinking it's some kind of gift or something, but these were frozen skulls, real skulls and all. So because it makes a difference. Now if you have seen in the other auditorium and all, I just briefly glanced there, it looks like almost OT, including the dresses and everything, because once we do it, like theory is one thing, or many of the YouTubes, maybe procedures may be on YouTube, but doing it physically is what makes a real difference. And that's the one. I mean, obviously you cannot try on a real patient. I may have some side effects and all that, but like this is like a realistic experience on real skulls, and also it's a great effort, and I'm sure there was a lot of demand for this conference. We had to limit, and even then so many people were there. So it's a first of many things. We'll keep doing things, and in Yashoda we are always like being ahead of the curve, like in everything from lung transplants. Last month we did 7, probably highest in the country, like ECMOs, like liver transplants and all. But neurosurgery, we have a very good volume of everything from brain tumors to DBS to skull-based surgery. So skull-based for laymen and for press and all who has come here, it is a minimally invasive surgery. I mean, it is just like a small endoscope. If you see outside, it is introduced through the base of the skull. అదర్వైజ్ బ్రెయిన్ సర్జరీ అంటే మనం అనుకునేది మొత్తం ఇట్లా ఓపెన్ చేసి చిప్ప ఇట్లా తీసి పెడుతూ ఇంతకుముందు అట్లనే ఉంటుండే అండి. బ్రెయిన్ సర్జరీస్ ఆర్ లైక్ రియల్ లైక్ ఓపెనింగ్, అండ్ మన విజయసాగర్ సార్ ఉన్నారు ఇక్కడ నిమ్స్లో అప్పుడు, ఆర్ మేబీ ఉస్మానియాలో పాత ఉన్నప్పుడు అది ఇట్ వాస్ లైక్ ఎ రియల్ థింగ్. బట్ బ్రెయిన్ ఈజ్ చాలా కాంప్లికేటెడ్ ఆర్గన్. చిన్న ఎనీ స్మాల్ డ్యామేజ్ కెన్ కాజ్ పారాలసిస్ ఆర్ సంథింగ్ ఎల్స్, సమ్ అదర్ సైడ్ ఎఫెక్ట్స్. సో ఇదంతా అప్రోచ్ చేయలేము. సో మినిమలీ ఇన్వేసివ్ అప్రోచ్ విత్ లీస్ట్ ఆర్ నాన్ ఎగ్జిస్టెంట్ సైడ్ ఎఫెక్ట్స్. అండ్ ఈ బ్రెయిన్ ట్యూమర్స్ కూడా లైక్ సమ్ ఆఫ్ ద ట్యూమర్స్ లైక్ పిచ్యూటరీ, adenomas and all, ఇంతకుముందు ఇంత లేకుండా, మేబీ ఫర్ వాట్ ఎవర్, మేబీ యూఆర్ లివింగ్ లాంగర్ ఆర్ మేబీ మోర్ క్యాలరీస్ ఆర్ వాట్ ఎవర్, సమ్ ఇన్సిడెన్స్ ఈస్ ఇంక్రీజింగ్. బట్ నౌ ట్రీట్మెంట్ ఆల్సో ఈస్ దేర్, అండ్ ఇట్ ఈస్ ప్రీవియస్లీ బ్రెయిన్ ట్యూమర్స్ ఇట్లుంటే ఆల్మోస్ట్ ఇట్ వాస్ లైక్ ఎ డెత్ సెంటెన్స్. ఈవెన్ ఇన్ ద బెస్ట్ కేస్ సర్జరీ ఓపెన్ చేసినా కూడా విత్ ఎ లాట్ ఆఫ్ సైడ్ ఎఫెక్ట్స్, వన్ సైడ్ పెరాలసిస్ అట్లుంటుండే. ఇప్పుడు దేర్ మెనీ పీపుల్ ఆర్ జస్ట్ వాకింగ్. ఈవెన్ డాక్టర్స్, ఐ నో సమ్ డాక్టర్స్ హ్యావ్ దిస్ ట్యూమర్, అది చేసినాక మళ్ళీ వాళ్ళే పోయి కూడా మళ్ళీ దే ఆర్ డూయింగ్ దేర్ ఓన్ సర్జరీస్ ఆల్సో. దిస్ కైండ్ ఆఫ్ థింగ్ వాజ్ నాట్ దేర్ ఇన్ ద పాస్ట్. And so brain tumors and brain surgeries are not like previously, like almost like a death sentence kind of laid, and so a lot of advances have come. So I think we have to propagate, and we have faculty from and delegates from all over. So together also some things in Indian conditions, how best to do anedi, it is not there in the international guidelines. So those kind of things will keep evolving in these kind of things. So great. And సమ్టైమ్స్ ఒకప్పుడు ఎనీ బ్రెయిన్ సర్జరీ ఉన్నప్పుడు మెనీ ప్రెస్ వాళ్ళు కూడా ఒకటి అడుగుతున్నారు, సెల్ ఫోన్ వాడితే బ్రెయిన్ ట్యూమర్ వస్తుందా అని. మేబీ చెప్పాలేమో, కొంచెం రిస్క్ ఉంటుందండి. సో దట్ ఇంత డైలీ వాడేది సెల్ ఫోన్స్, కానీ అది ఇట్ ఈస్ నాట్ ప్రాక్టికలీ ప్రూవెన్. ఐ మీన్ దెర్ నో లాంగ్ టర్మ్ స్టడీస్ లైక్ for 20-30 years and all, but even if there is small things, how their treatments have advanced very much. Anyhow, I'll not take too much of your time in this, like a real high quality. అంటే పెద్ద నేషనల్ కాన్ఫరెన్సెస్ అట్లాంటివి ఉంటాయి, and most people వచ్చి just it is like a vacation kind, but this is like all of the doctors are very qualified and they are doing it in the surgery. So I'll not take too much of your time, and we'll invite our chief guest, ma'am, next.